For my presentation and topic, I decided to look into cystic fibrosis. So, the background to cystic fibrosis is that there's a CFTR gene which provides instructions for making a cystic fibrosis transmembrane conductance regulator protein. And this protein creates a channel across the membrane of cells that produce mucus, sweat, saliva, tears, and digestive enzymes. This channel transports negatively charged particles called chloride ions into and out of cells. The transport of these chloride ions helps control the movement of water in tissues, which is necessary for thin, freely flowing mucus. Cystic fibrosis is caused by a gene mutation in the cystic fibrosis transmembrane conductance regulator protein. And here is what the CFTR protein looks like. So, in cystic fibrosis, there are actually more than 1,000 mutations that can occur in the CFTR protein that can cause cystic fibrosis. But I'm going to talk about the most common mutation, which is called the delta F508, which is a deletion of one amino acid at position 508 in the CFTR protein. The resulting abnormal channel from this mutation breaks down shortly after it is made, so it never reaches the cell membrane to transport chloride ions, which causes the no control over the movement of water. So instead of the mucus being able to be thin and freely flowing, it gets all thick and sticky because there's not enough water. So in cystic fibrosis, there's heterologous expression of the CFTR protein, which provided evidence that the major cystic fibrosis mutation delta F508 leads to defective protein folding in the endoplasmic reticulum, which prevents its processing and targeting to the cell surface. As you can see over here, this is the full CFTR protein, and right here, the F508 gene is not freely flowing like the rest of this protein. It's bunched up in one little circle. Cystic fibrosis, it is a genetic disease. So people with cystic fibrosis have inherited two copies of the defective gene. One copy comes from each parent. Both parents can have at least both parents must have at least one copy of the defective gene, but sometimes they can have two copies of it, which causes a cystic fibrosis. Um, People with only one copy of the defective gene are called carriers, but they do not have the disease. Cystic fibrosis is also a recessive disease. So the probability of getting cystic fibrosis is 1 in 4 or 25%. Um, there's also a 50% chance that a child will be a carrier of the disease but not actually have cystic fibrosis. And then there's a 25% chance that the child will not be a carrier and will also not have cystic fibrosis. Here's just a little representation of that. So both parents are a carrier, so 1 in 4 kids will have cystic fibrosis, and then 2 in 4 will have the gene but no symptoms of cystic fibrosis, and then 1 out of the 4 will have no carrier and no disease at all. And then here's another example that shows that if one parent has cystic fibrosis and the other parent is a carrier, um, 2 out of the 4 kids will have cystic fibrosis, and 2 out of 4 will be a carrier but not show any signs of that disease. So the prevalence of cystic fibrosis, it's pretty common within the white population of the United States. The disease occurs in 1 in 2,500 to 3,500 white newborns. However, cystic fibrosis is less common in other ethnic groups, affecting about 1 in 17,000 African Americans and 1 in 31,000 Asian Americans. So here's this little diagram that shows you that in the US and Alaska, they have the highest population of cystic fibrosis people, while everywhere else has a lower rate. And in this diagram, you can see that the blue of the populations is not as dark. So the symptoms of cystic fibrosis will vary depending on how severe your mutation is and which type of mutation you have of the CFTR gene. So, people with mild cystic fibrosis will have symptoms like recurrent pancreatitis, infertility, and recurring pneumonia, while um, patients with the Delta F508 mutation or other severe mutations of the cystic fibrosis disease will have a thick, sticky mucus associated with their disease, which clogs the tubes that carry air in and out of your lungs. So, symptoms like persistent cough with thick mucus, wheezing, exercise intolerance, repeated lung infections, inflamed nasal passages, or a stuffy nose are all symptoms of severe cystic fibrosis. And CF can also affect your digestive enzyme by having the thick mucus block the tubes that are in your pancreas all the way to your small intestines. So symptoms of this will include poor weight gain and growth, intestinal blockage, and chronic or severe constipation. And here I just wanted to provide a little um, visual diagram of cystic fibrosis in the lungs. So, in healthy lungs, you can see that right here the airway is super clear and there's nothing blocking it. While in the lungs affected by cystic fibrosis, you can see right here in the middle, that's the only airway for these lungs, while the yellow all around that is the thick mucus that clogs the airway. And then for cystic fibrosis, there is currently no cure, but there are lots of ways to successfully treat and manage this disease. So the first and most common is called airway clearance therapy, which is a device that is worn like a vest that shakes your lungs and the mucus in your lungs that allow you to cough it up. And then simultaneously with this therapy, people use a nebulizer that has a mucus thinning medication that also helps get that mucus out of your lungs. And these two treatments together are the most common treatment for cystic fibrosis currently. Um, for managing cystic fibrosis, this usually requires constant monitoring and constant trips to the doctor for checkups. People with cystic fibrosis usually require multiple tests like blood tests, bone mineral density tests, glucose monitoring, pancreas functionality tests, and respiratory cultures. And some tests that could be recommended by your doctor for um, further checking and checkups will be ultrasound, chest CTs, X-rays, colonoscopies, and lung biopsies. Um, Other than doctors, people with CF can live a healthy lifestyle, including good hygiene, getting all their vaccines, maintaining a healthy weight, and physical activity to help maintain lung function. It is important for people with CF to have good hygiene and get all their vaccines because when they get sick, it's not like a normal sick. It usually is worse for people with CF. So, like a common cold for normal people could turn into pneumonia for a person with CF because of their poor lung function. And then here's my works cited and